family physician, Dr. Jen Caudle, here with us now to discuss. Okay, Dr. Caudle, what do you think of the CDC's new guidelines? And is this just an attempt to encourage people to get vaccinated?
So, I think that these guidelines were sort of long awaited by a lot of people. I think a lot of people are excited to see that some of the restrictions are being lifted in terms of wearing masks as we as a nation become more vaccinated. Do I think that this is an attempt to get people more vaccinated? Well, I think that in the process, it certainly may encourage people to do that. But, the CDC, of course, is following the science. And one of the things that we know is that transmission of COVID-19 is a lot lower, a lot less outdoors than indoors. And that's what this reflects. So, I should just say, too, I encourage, and you've got the graphic up, I think this is really important to take a note of. I think one of the sort of the take home messages is that if you are fully vaccinated, you are pretty much able to be outside without a mask. Except in crowded areas, outdoor events, parades, sports events, concerts, things like that, you need to wear a mask in crowded environments. And then we also have the unvaccinated people and what they are able to do or not. I should say one caveat is I do still want people to use their good common sense, right? Take an assessment of your own individual risk level and also put that into play as you're making decisions.
I think that's great advice. And look, I'm paid to report on this stuff and I follow it in and out every day. But even I was a little confused at following these guidelines. Do you think the CDC, are they being too cautious here? Because even this, saying, okay, you don't need to wear a mask if you're going for a run outside. I'm as cautious as it comes. I have not been wearing masks when I run outside by myself, all pandemic. Do you think that they need to go further? Because for people who maybe are on the fence about getting a vaccine, it feels like they're not able to, it's not like they're doing that much less than if you're fully vaccinated.
So you bring up a couple of points. The first point is that you mentioned sort of this idea of the chart and a little bit of confusion. I have to admit, I'm a physician. I stared at this chart for a good 30 minutes when the guidance first came out. And I read every article I could and looked at the press conferences to really try to make sure that I understood what they were saying. You got the chart up there. We should also point out that unvaccinated people, according to the CDC, can also walk, run, bike outdoors with members of their household, attend small outdoor gatherings with fully vaccinated people without a mask as well. I looked at this for a long time, and one of my first thoughts was it would have been nice if this were simpler. Okay, I think a lot of people are like, oh, okay, let me see, let me understand. Yeah, do I wish it were sort of simpler and more streamlined? Yes, I do. But I appreciate the thoughtfulness with the CDC. If they feel like they need to go with this measured step-by-step approach, then look, I'm going to be a fan of this. Their job is to keep this country safe and to be thoughtful in that process and follow the science, whether or not it falls in line with what I would like or not. So do I want it more streamlined and more simple? Yes. But am I okay with sort of the stepwise approach? If this is the best and safest way for us to go about this, then yes, I am fine with it.
Okay, you're making me feel so much better because I was going through this chart yesterday thinking, wait, who's in a mask? Yep. Who's not in a mask? What is this?
Right.
Okay.
Yes,
so
I found it very confusing.
If you were confused, I feel better that I was confused. What are you seeing? You treat patients. What are you hearing from people in terms of vaccine hesitancy? Are people getting more comfortable now that so many Americans are vaccinated, or is that hesitancy still there?
I was in the office yesterday, and I have to say half the patients that I saw when I was there, half the patients had been vaccinated, half the patients did not want to get vaccinated. I offer them vaccines. I can sign you up. I can get you on our list at Rowan University. Can I offer you the COVID vaccine? They said, no, I'm good, or I'd like to hold off. I asked then, this is my sort of usual, are there questions about the vaccine I can help, answer? Is there some concerns you have? And in some cases I got concerned, some cases I didn't. I am afraid of this. This scares me. Half the patients, and I'm just sort of a sample size of one, but I'm seeing this more and more and more where, yes, not only are we hearing about this in the news with the actual numbers, but we are seeing patients sort of the numbers of vaccines kind of slow down. In Philadelphia here, I just saw an article that, we've got 4,000 or something doses of the COVID vaccine that need to be given by Thursday. I live in the city of Philadelphia. I am concerned that people are not getting this vaccine at rates at which maybe we were, at rates at which we should. This can't stop. This can't slow down. And I implore everyone out there to get vaccinated. It is great that others are, but that doesn't mean that you don't need to. We all need to be vaccinated, all of us who can be. It's so important.
And one of the other critiques sometimes that the media gets is that we always focus on the negative, but things are going a lot better with COVID right now. I'm curious what you're seeing in terms of COVID cases. They're down about 20% nationally compared to a couple of weeks ago. What are you seeing on the ground?
Right. Well, first of all, thank goodness for that decrease. I would still argue, and I think many of us would, that our numbers are still higher than we want them to be, higher than they should be. On average, I am seeing fewer cases of COVID with my patients than I had before, but I'm still seeing cases of COVID. I have patients in the hospital right now with COVID. I was just talking to my mother last night. Up to yesterday, we had 3 family members that had died of COVID. I just found out that a distant cousin of my mother's passed yesterday from COVID. So that's the 4th case in my personal family. It's wonderful that these numbers are down, but down is not gone. That doesn't mean away. It doesn't mean that we're done. We still have too many cases of COVID, and it is affecting people's everyday lives. So we can't let up. We have to get this vaccine, and we still have to use the safety measures that we know are important, including mask wearing in certain situations and other measures that we've been talking about.
Great information and insight. Family physician, Dr. Jen Caudle, always great to have you on. Thank you.